there's plenty of studies that show experiments where people with psoriasis have had their tonsils removed, and then their psoriasis improves. And when they dissect the tonsil tissue, they find the strep in there in biofilms. So there's a lot of things, like you said, that could be driving psoriasis.
Psoriasis, right? There's a lot of people out there that have psoriasis. The biggest reason that people spend on medications, the two top sellers are immune suppressants. Number three is statins. But the two biggest drugs that are Humira and Keytruda, and both of these address the immune system, they suppress the immune system so that people don't have the symptoms of psoriasis, rheumatoid arthritis, and a ton of other things. What are the root causes you find in people that have, for example, psoriasis?
So, psoriasis, as you said, it's an immune system problem. We used to think, oh, it's a skin problem. We could see the psoriatic plaques. We know that the skin is building up at a quicker rate. And so originally we put it in the dermatologist bucket because we're like, oh, that's a skin disease. And then through the years we realized, no, this is an immune system disease. The immune system is thrown into overdrive. And we have lots of different types of immune cells. Some of the types of immune cells we have are called Th or T helper cells. And in particular, we have these Th17 cells. And in psoriasis, particularly, these Th17 cells are overactive. They have been thrown into overdrive, and it's like your body is just producing an army of Th17 cells. And it's too much, and that causes the inflammation and all the skin problems that we're seeing. But when we back up and say, okay, well, why is the body building this army of Th17, soldiers to go out and start to fight things? That's where we go back to the gut. And your listeners may have heard of a term called leaky gut, but may not know exactly what that is. Well, when we go back to our digestive system, let's take the small intestine where we digest food and absorb nutrients. We should have a thick mucosal barrier throughout our entire intestinal tract. And that mucosal barrier is of supreme importance. It's kind of like the velvet rope at an exclusive club, with bouncers who are deciding you get in and you don't get in. And our mucosal barrier will let in the good things like the nutrients that we are absorbing from food. We need the glucose and the vitamin A, and all of those things. That all gets to get through that mucosal barrier and absorbed into the bloodstream so that every cell in the body can get those nutrients. But the mucosal barrier is going to do a good job of keeping out those 3 to 5 pounds of microbes, like bacteria, for example, that are living in our gut. So we need that mucosal barrier to be healthy and functioning to say, good guy, you get through, bad guy, nope, you don't get to go into the bloodstream. When a leaky gut, the problem is people's mucosal barrier has been eroded. And so there's kind of gaps and holes where things can get through, even the bad guys. And once that gets into the bloodstream, the immune system goes, wait a minute, you're a bad guy. You're not supposed to be here. Now I need to build an army to fight you. And so that's one of the reasons that leaky gut will drive those Th17 army cells to increase. Another example is strep throat. The bacteria, Strep pyogenes, that causes strep throat is one of the number one environmental triggers that we know of that will cause psoriasis. And strep throat, where does that live? On our tonsils.
Mm-hmm.
And the Th17 cells are at all the mucosal surfaces. So the mucus in our gut and the mucus on our tonsils. And so if somebody gets strep throat, the Th17 cells are responsible for responding to that and going and fighting it. Now, sometimes the strep can form what we call biofilm and kind of hide under the biofilms where our immune system can't get it. And then you're going to keep producing Th17 cells without being able to attack and kill it. And there's plenty of studies that show experiments where people with psoriasis have had their tonsils removed, and then their psoriasis improves. And when they dissect the tonsil tissue, they find the strep in there in biofilms. So there's a lot of things, like you said, that could be driving psoriasis. You could have strep throat or have strep colonizing your tonsils. You could have leaky gut. But it's basically things that are overactivating the immune system. And then someone usually has a genetic predisposition to, okay, when things are overloading your system, this is the direction you're going to go in. You're going to produce, you're going to get psoriasis. Other people might develop different autoimmune type diseases like multiple sclerosis or, different diseases. So there's also a genetic component to what types of diseases people end up with. But yeah, it's complicated, but it really does go back to the gut microbiome a lot of the time.